And I would like you to welcome Dr. Dang from the University of Medicine and Pharmacy at Ho Chi Minh City to talk about the association between air pollution and COVID-19, good and the bad. Thank you very much. And thanks, Dr. Takeuchi again for your nice talk.
Okay,
Dr. Dang, please.
thank you, Dr. Wee. It's really delighted to be part of today's seminar. And I am Dang from Department of Environmental Health, University of Medicine and Pharmacy at Ho Chi Minh City. So for today's seminar, in previous presentation, we discussed a lot about the measures and the strategy to cope with COVID-19. But I think of myself, it's also important to think about the strategy to address the risk factors of other NCDs disease that affected by the COVID-19, and air pollution is the one. Because when we understanding how air pollution changed during the COVID-19, it will give us important clues on the health effects, also about the emission controls. So for today's talk, I want to discuss with you about the association between air pollution and COVID-19, the good, the bad, and the ugly. Actually, three angles of the association. And let's move to the outlines. And first, I will give some background, in particular about the air pollution level and its health effect in Vietnam. And then I talk about the good, the bad, and the ugly side of the association. Let's see some figure. So according to some database like Air Visual, Hanoi and Ho Chi Minh City, the two biggest cities in Vietnam, ranks most polluted city in the world. And according to the global burden of disease, air pollution is considered the most significant environmental factor that's called the most burden of disease in Vietnam. And it's estimated that from WHO, each year more than 60,000 deaths, extra deaths linked to the air pollution in Vietnam, which is a very huge number. You know, so far COVID-19, we only have 35 people die, but each year due to air pollution, we have 60,000 deaths linked to the air pollution. That reminds us, we should not only focus on the COVID. I also very agree with Dr. Wing and other speaker. It's now also the time we should pay attention to all the NCD disease, to all the risk factor that affected by the COVID-19. And let's see some background about the main sources. This figure shows that the main source of air pollution in Ho Chi Minh cities came mostly from the transportation, the red part, and industry and the household came to second, and the small emissions came from biogenic source. Among transportation, motorcycle were the main reason of emission in Ho Chi Minh City, and it's contributing to 90% of the CO, 68% of the organic compounds, 63% of the methane, 41% of the SO2, and 29% of the NOx, and 18% of the particulate matter PM2.5. And for the effect of air pollution on health, it can affect many different stages of our life, ranging from pregnancy woman to newborn baby, to the early childhood, and up to the adult life and the elderly. And it can cause in a pregnancy woman the risk of the reduced growth, and increase the risk of preterm birth and low birth weight. In particularly, the group that most vulnerable to the air pollution effect is the early childhood children group, the group from 0 to 5 age. During that period, if children exposed to the air pollution, it will increase the risk for the decreased lung growth, reduce lung functions, and increase the risk for lower respiratory infections, including pneumonia and some effect on the deep developmental effect. And that's not end. When these children become adult, they also increase risk of the chronic respiratory and cardiovascular disease. In Ho Chi Minh, in Vietnam, our group have done several research to provide the evidence about the effect of the air pollution on health. And the paper you see on the slide showing the effect of ozone on the hospital admission for the respiratory disease in Hanoi, Vietnam. And we found that it increases of 10 microgram per meter of ozone is associated with the increases of 6.2% risk of admission for respiratory disease among the children in the winter compared to that of only 1.2% in the summer. This is a quite interesting point to point out. Because actually ozone is a secondary pollutant, and the concentration of ozone is higher in the summer compared to the winter. But our result indicated that ozone in the winter will induce more risks for hospital admission than compared to the summer. And our just published paper about the PM2.5 and the risks of lower respiratory infection among young children in Ho Chi Minh City, we also found the positive effect of PM2.5 on the hospital admission, and the effect vary between gender, male and female, and between age group, and also the type of the disease. So why children exposed to the PM2.5 are more likely to be infected with the acute bronchiolitis than with the pneumonia. And we also do some modeling, and this is the estimate of the long-term concentration of the main pollutant in Ho Chi Minh City, in which we found that NO2 and PM2.5 always higher than the standard. And PM2.5 were found to be responsible for about more than 100 and 1,000 deaths. Similar, NO2 and SO2 were attributed to 172 and 89 deaths respectively in Ho Chi Minh City. And I want to skip the update of the number of cases. Let's go to the good aspect of the COVID-19, which is represent very clear through this picture. The left picture, the right picture is and the left picture show the same streak before and during the COVID-19. We see an extremely reduction in the transportation activity during the lockdown of the COVID-19 period. And with the reduction in the transportation in the industry activities, we will expect the reduce in the concentration of the air pollutant. And can you guess how many percent we will reduce in the air pollutant? The answer is it depends on the air pollutant. CO is the pollutant main come from the transportation, and it's reduced the most. And according to our data, we collect the data of the 4 stations surrounding and within Ho Chi Minh City. We see that the CO concentration reduced about 60% during the lockdown compared to the before and the after lockdown periods. For the TSB, which means the total suspended particulate, is reduced 17%, and SO2 reduced 14%. NOx decreased 9%. So most the major pollutant decrease during the lockdown. That is very good sign of the COVID-19. And how about the bad side? So some evidence suggested that air pollution can be considered a core factor in extremely high level of SARS-CoV-2 letalities in the northern Italy. In the paper, the author showed the evidence that the region with high level of concentration also have the level of letalities. And this is blendable because, you know, air pollution can weaken our respiratory system. And the SARS-CoV virus mainly attack to the respiratory. Therefore, it can, when people exposed to the air pollution for the long term, it will increase the vulnerable to the virus infection. And the second reason is because air pollution is the main risk factor for many comorbidities disease of the COVID-19, like the hypertension, like the cardiovascular disease, like the chronic respiratory disease. So based on COVID-19 patient, when exposure to air pollution, it's also increase the risk of letalities. And the second one, air pollution, also there's some accumulate evidence about the association between air pollution and the spread abilities of the COVID-19 in Chinese cities. So you can see on the slide, so in the association between dioxide, nitrogen dioxide, and the reproduction number in the city outside the Hebei and in the city inside the Hebei, we see clearly a strong connection between the air pollution and the spread abilities of the COVID-19. And finally, I want to talk about the ugly side of the COVID-19. This figure shows the PM2.5 during the lockdown compared to the before and after lockdown. It's very weird that we're very surprised when we see this result. First, we look at the data of the third party, which is the Palm Air Network, include 31 stations within Ho Chi Minh City that measure PM2.5. And the green one is a concentration during the lockdown. You see, during the lockdown, the concentration of PM2.5 is a little bit higher compared to the before and after. Similarly, we look at another third-party data of the USA General Consulate, which is a quite standard station, quite expensive station compared to the Palm Air Network, which is the low-cost sensor. And we see very similar pattern in which the concentration of PM2.5 higher during the lockdown compared to the before and after. But we still not believe. Therefore, we decide to measure by ourselves. And we measure 96 stations representative for 24 districts of Ho Chi Minh City, as you can see on the map. And we also show obtain the similar result, higher concentration of PM2.5 compared to the before and after lockdown. So the question why this happened? There are several theories can put on the table, like the effect of the humidities, like the secondary source of the PM2.5 in Ho Chi Minh City. But to be honest, we still do not have the answer yes for this question. That's why I named this part of my presentation at the ugly side of the COVID-19. And For the second part, because I working now in the Innovation Center of the UMB, and during the COVID pandemic, we collaborate with the universities of technology in Ho Chi Minh City to create some innovative solution, and I want to share with you today. First, we create a container room for treating COVID-19 patients, and the characteristics of this container room is 100% infection control using the HEPA filter, and it's designed as a Lego game where all the components can easily connect each other, and it's designed as a one-way system. Include many different components like the buffer room for exchange the clothes, and there is the surface disinfection room, the shower room, and the facilities for treating the patient. And one important characteristic of this system is quite cheap, and the material is easy to find in the Vietnamese market. So therefore, just in the worst case, like the third wave of the COVID come to Vietnam, we can easily to do the mass production if needed. And then the second one, we create the so-called the power air purified respirator. Actually, some evidence provide that the BAPR is better to protect the medical staff when treating for the COVID-19 compared to the N95 or surgical mask. However, the price of the market product is very high. So we try to create the new prototype with cost only 1 to 10 compared to the available market product. And we also use some 3D technologies to transform the snorkel mask into the mask using for the NIV, the non-invasive ventilator. And we also create the real ventilator with Bách Khoa University, as you can see on the video. Yeah, and this is the demo for the UV chamber. This infects the mask for the use. Okay, with that, I want to conclude my presentation. Thank you very much for your listening, and I'm waiting for your question. Thank you.
Thank you very much, Dr. Dang, for presenting interesting data about the correlation between air pollution and the COVID-19, and also introduce interesting innovation for the healthcare worker. And I hope you can bring those products into the market.
Yeah. We are trying our best to do so.
Okay. I would like to invite some questions from the floor. Any question for Dr. Dang?
Yeah, can you explain more about the PM 2.5? Do you have any assumption why the PM 2.5 is increased after the COVID-19? Because the vehicle is not too much. So
thank you, Dr. Ang, for that question. That there are some theories we want to test. The first one, as I explained, we use even we use different source of data. Some data from the third party, some data measured directly by our group. But it seems that on the device using the scatter lighting methods to quantify the PM2.5, and that methods highly affected by the humidities. So when the humidity is high, the sensor will detect as the particulate matter PM2.5. However, we already checked the humidity data during the lockdown periods. It seemed not high compared to the before and after. So the second theories, I think in Ho Chi Minh cities, PM2.5 came not only from the transportation activities, but it came from the secondary pollution, like ozone. Ozone is a secondary pollutant. It's result from the photochemical reaction in the air, and NO2 plus some other pollutant under the photochemical reaction will result the ozone. And many papers show that during the lockdown, the ozone increased compared to before and after. So I think maybe PM2.5 is a similar case compared to the ozone. But to be honest, so far we don't have the correct answer for that question. That's why we name that part as the ugly, ugly side of the association.
Thank you very
Thank
much, Dr.